Hello. So we're going to be testing your light sensitivity today. Now, before we begin, what I need to do is just take a few details, if that's okay with you. So, if I could have your full name, please. Okay, and your date of birth. Okay, and where are you living at the moment? Can I have your address? All right, and what gender do you identify with, male, female, or non-binary? Okay, and have you had any issues with your eyes in the last 12 months? All right, good. And anybody in your family with any eye disease, glaucoma, diabetes, diabetic retinopathy, cataracts? Okay, that's good. All right, so my name is Dr. Laughing Heart. It's a double-barrel name because I'm quite posh. I'd like to introduce my two colleagues, Dr. Joey and Dr. Mickey Rourke. They're the two clinic service dogs that'll chill you out if you're feeling at all nervous. So, should we begin? All right, so first of all, what we're going to do is I'm going to have a look at the general layout of your face just to see if there's any asymmetries that we need to be concerned with, and just to check the general bone structure, which I have to say is classically beautiful. And if there's any issues with your eyes, any conjunctivitis or any infection or problem that might influence the results of the test that we're going to do. Okay, you might find the dog snore a little bit, and again, some people find that relaxing, so you should be in a very calm state for the test that we're going to do. So, if I get you to lift your chin up a little bit for me. That's good. All right, good. And if you can look straight ahead, and I'm just going to have a feel along the brow line and just along the orbit of your eyes. Yes. Good, good, good. All right. So, what we'll do to begin with then is just going to shine this guy in your eyes, and this just gives me a closer look at what we're dealing with. So, if I get you to look straight ahead for me, please, if you can choose one of the lights that's on the background there, and I'm just going to be shining this in your eyes just for a second or two. Okay, good. Alrighty, and if you can look up to the ceiling for me, please. I'm just going to pull your one lid down. Okay, good. Perfect. All right, if you can look down for me, please. Yes. Good, 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 good. All right, good. If you can look up again for me, please. Perfect, 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 perfect. And again, if you can look down for me, please. That's great. Good for you. Good, 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 good. All right, and if you can look straight ahead again for me, please. We'll just have another general overview of your eyes. There we go. Good for you. Okay. That is perfect. Good, good. All right, so what we're going to do next is I'm going to get you to have a look at the light at the end of the torch. Now, what I want you to do is to keep your head absolutely still and just with your eyes, just follow the light for me. Okay? So if you keep following the light, keep following the light. Perfect. Great. You have clearly done this before. You're very, very good at it. Good. That's great. Keep looking at the light. Just follow it with your eyes. And if you can tell me if there's any discomfort or pain when I bring the light out into the periphery of your vision. Okay, good. Okay. That's fine. All right, now we're going to do the same again, but this time we're going to do concentric circles, and they're going to get ever smaller. So I'm going to start up here. So if you elevate your eyes just a little bit, and again, if you can keep your head keep your head still, just use your eyes to follow the light for me. Perfect, perfect, perfect. And I'm going to get just a little bit closer. Okay, good. Excellent, 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 excellent. And if you could follow the light as the circle gets bigger. Okay, good. Is perfect. All right, and circles are going to get just a little bit smaller again. That's great, good. And again, a little bit bigger. You're doing very well. Okay, perfect, perfect, perfect. Now what I want you to do next, to give your eyes a little bit of a break, I'd like you to blink, 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 and blink. Okay? And if you could blink quickly, like this, and blink slowly, blink slowly, blink slowly. Perfect. That's great. Now, let's just see how much light you can handle. Now, I'm going to bring this very, very, very close. And what I want you to do is try not to blink, okay? So I'm going to bring this as close to your one eye as possible. And I want you to keep your eyes open as long as you can. Okay, good. Perfect. We're going to do the same with the other eye. So keep looking at the light for me. I'm going to bring it a little bit closer, a little bit closer, a little bit closer, a little bit closer. Okay, perfect. That's great. Now we're going to do the same as we did before, except this time I'm going to be using a slightly different light. And what I want you to do this time is I would like you to look at the tip of my finger just as I bring this light in. So keep looking, tip of the finger just here. Keep looking at the tip of the finger for me. Tip of the finger, tip of the finger. Perfect, perfect, perfect. Good, 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 good. Okay, good. And I want you to do the same again, but this time I'm going to bring my finger a little bit further away. So if you can just look at my hand over here, and I'm just going to bring the light in. So keep looking at my hand. Perfect. 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 Good, 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 good. That's great. Good for you. Now, I'm going to come a little bit closer. So what I want you to do is to pick one of those lights that's on the back wall, and I'm going to be bringing this light in very, 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 very quickly. Okay, and this checks your sensitivity to blue light. Yes. Good, 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 good. That's great. Okay, we're going to do the same with the other eye. So if you can pick any of the lights on the back wall, and I'm just going to bring this in. Okay, perfect. Okay, 10 out of 10. So far, so good. Okay, and we're going to use a different light for this test. Now, I'm going to do like a snake pattern across, and I want you, this tests your sensitivity to the light, and also checks your movements, what we call saccades, which is like a tracking movement of the eyes. And I'm going to do like a snake pattern. So I'd like you to follow. That's right. If you keep your head still, just like you did before. Okay. So if you keep your head still for me, and I'm just going to be bringing the lights in and moving across your vision in a kind of undulating, snaky sort of a pattern, and all the time I'm watching your eyes just to check for any loss of the tracking that may occur. Okay, good. All right, if you can blink, blink, blink. And now if you blink quickly for me, and now blink slowly, blink, blink. That's great, you're doing fine. Okay, what I want you to do next is I'm going to be shining this guy in your eyes. It's green light. And what I'm going to be doing is I'm going to be just moving my hand just across your brow. Now, I want you not to blink, okay, when you look at the light. So if you can look just at the light for me, please. And I'm just going to be moving my hand just across your brow. Okay, good. Okay, good. I'm going to try the other side. So keep looking at the light for me. And I'm just going to be moving my hand across your brow. Mm-hmm. Good, 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 good. You're doing very well. Okay, that's fine. Oops. Okay. So I'm just going to write down what we found so far, but so far you've exceeded expectations. You're very, very good at this. Okie doke. So, what we're going to do next now, this test may seem a little bit counterintuitive, but it's all to do with checking your light sensitivity. So, what I want you to do is if you can look and choose one of the lights on the string that we've got here on the back wall. And what I'm going to be doing is I'm going to be tapping your forehead. And the trick is, I don't want you to blink, okay? If you can keep your eyes open as long as you can, and eventually you'll need to blink, but if you can not blink for as long as you can. So pick a light, any light, and I'm just going to be tapping your forehead. Mm-hmm. Mm-hmm. Good, 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 good. You're doing very, very well. Clearly, you are very, very good at this. Okay, and blink, 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 and blink a little bit quickly like this, fast, and slowly blink, blink, blink. That's great. Now if you close your eyes just for a second, and I'm just going to be tapping just along the brow of each eye. And this is to relax you so that your eyes are nice and fresh for the next part of the test. Mm-hmm. Mm-hmm. Good, 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 good. You're doing very, very well. Good for you. Okay, and blink for me. Blink for me. Blink again. That's great. Good for you. All right, so next what we're going to do is going to be checking your pupillary response. So I just need to find a bright enough light, and I'm going to be bringing this in your line of vision. So if you can look straight ahead again for me and pick one of the lights on the back wall, pick a light, any light, and I'm just going to be shining this in your eyes. Direct, consensual. Direct, consensual. Direct, consensual. Okay, good. Direct, consensual. Direct, consensual. Direct, consensual. Okay, good. Just going to do that again. So, direct, consensual. 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 Okay. Now next, I want you to put your hand up like this for me, and I'm going to do the swinging light test. Mm-hmm. Okay, good, 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 good. That's fantastic. Good for you. Okay, good. That is fine. Okay, now this test rather, can be a little bit subjective, but we're going to give it a go anyway. Now, this is a light bar, and I want you to tell me when the intensity of the light changes, okay? So if you just say now, when the intensity of the light changes, I'm going to bring it very, very close. So we're going to begin now, and you tell me when the light changes. Yes, good. And now. And now. Good. 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 Excellent. Now I'm going to bring it a little bit closer, and we're going to do the same thing again. So, have a blink before we begin. So blink, blink, Okay, you ready? Good. Okay, tell me when the light changes. Good. Perfect. How much light can you handle? That's the question. Good, 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 good. That's great, good for you. All right, perfect results. Well done. Okay, so I'm going to just pop this over here. And what I'm going to do next is I'm going to be having a look at the health of the back of your eyes. So I'm going to be using this little guy here. And I'm going to be coming very, very close. I hope you don't mind. Okay, so let's just check. Okay, so if you blink for me, let's get this the right way around. And I'm going to come very, very close, and I'm going to be shining this right into your eyes. Okay, good. Alrighty. If you can look up to the ceiling for me. Perfect. Good, 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 good. Alright, if you can look down to the floor. And if you look to your left, and to your right, and if you look straight into the light, yeah, it's a little uncomfortable, sorry about that. Okay, we're going to do the same with the other eye. So if you look straight ahead to begin with, I'm just going to pop this in place, and that's it, just keep looking straight ahead for me, please. And if you can look up to the ceiling, and if you look to your left for me, please. That's great, you're doing very, very well. If you can look to your right, and look down. Perfect. Alrighty. And if you can look straight ahead again for me, please. That's great. Good. Okay. Eyes are looking nice and healthy. So, just get rid of that. And we'll have a look next with some red light. Okay, now this shows up the vessels at the back of the retina. So I'm going to get you to look straight ahead again for me, please. I'm just going to be shining this in your light, just in your eyes rather, just for a second or two. So I'm going to do one eye at a time. Okay, good. Perfect, 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 perfect. Okay, perfect. If you look straight ahead again for me, please, and see what those blood vessels are up to. That's great. Good, 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 good. That is perfect. Mm-hmm. Okay, that's fine. Okay, now, what I'm going to do next, just because your eyes have been through quite a lot today, I'm just going to pop a drop of this in each eye, and this just refreshes your eyes because they'll be feeling a little bit on the dry side. So I'm going to be just popping this in your eyes. Doesn't hurt, don't worry. Makes your eyes feel lovely and refreshed. So, if I get you to look up to the ceiling for me, please, I'm just going to pull down on your lid and I'm just going to pop that drop in there. Okay? And if you blink, that's right, blink, You all right? That's fine. All right, if you can look up to the ceiling again for me, it's going to pull down on your lid. There you go. And I'm just going to pop this drop in. If you blink, blink, blink. Yes. That's great. And one last test. Okay, we're going to use this guy here. And again, it's a bright light. And just so as my hands are free, I'm going to be coming very, very close and just examining in greater detail the health of your eyes. Okay, and again, if you can look up for me, please. That's good. Look down, I'm just going to lift your lids up. Perfect. And if you can look straight ahead again for me, please. Okay. That, my friend, is 10 out of 10, 100%. You passed the test. So your light sensitivity is A1. So what we'll do is we'll see you again in 6 months' time. But if you have any issues between now and then, of course, just pop back in. I'd like to thank you on behalf of myself, Dr. Laughing Heart, Dr. Joey, the pug, and Dr. Mickey Rourke, the Chihuahua, who's busy sleeping over there. So we'll see you again next time.